My name is Ryan Haack. I'm a customer service operations team member at Dean Health Plan in Wisconsin. To address the elephant in the room right off the bat, I was born like this. I don't want to get too serious right away, but try to put yourself in my parents' shoes. Imagine trying to tell people over and over and over why your baby has a full beard. It was a hard, a lot of respect for my parents. All right, so I did not have a full beard when I was born. I was close, not full. But I was missing my left arm below the elbow. Back in 1977, when I was born, it was a surprise to everyone in the room, especially my parents. After the initial chaos, though, they determined I was a healthy baby boy and gave me to my parents. And for the next 30-plus years, I could not have cared less about the fact that I had one hand. Now, don't get me wrong, I knew that I only had one hand. It was not a surprise to me. I just didn't really care. I played baseball, football, basketball. I didn't play soccer, ironically. Everyone thinks I play soccer. I didn't. I learned how to tie my shoes, button my pants and shirts, how to ride a bike. I just figured out the best way for me to accomplish the task that I wanted and needed to do. Now, fast forward to 2009, I was eating dinner at a restaurant near my house, and I see this little boy walk by, and he has an arm like mine. Now, up to that point, I had never really noticed like the arm status of people around me. It just wasn't something that came into my mind, but he caught my eye. So as I got up to leave, his mom from the other side kind of ran to me, kind of dragging him along, and basically presented us to each other, right? Like she's just like, you are this, and you have that with, and he, but you're old, and so he's, so something, it was kind of like that. So we chatted for a little bit, and then I left, and they went back to their table, and I left the restaurant, and as I walked to my car, I felt like I just wanted to give them both a big hug and just be like, everything's going to be fine. Like Grace talked about yesterday, I wanted to help. And so I started thinking about the experience with them, and this is that little boy, that's Luke, and that's my actual license plate, I know. And so I thought more about the experience with that little boy and his mom, and it made me realize something incredibly important, and that is that I believe the single biggest contributing factor as to why I grew up, quote-unquote, not caring that I had one hand was the supportive community that surrounded me. My parents, my extended family, my friends, my teachers. And when I realized that, as I was walking back, I felt like I needed to try and create that same supportive community for other people who might be in the same situation. So in 2011, I launched my website, livingonehanded.com. Fairly straightforward. My first post was titled, "Buttoning My Back Left Pants Pocket is Lame." Because it is. It isn't good. Clearly very highbrow content on my website. But what I do is I share my experiences there living as a person with a physical difference, from how I deal with being stared at, to my thoughts on and experiences with prosthetics, how sometimes I have a little fun with my arm at other people's expense, which I'm sure is shocking to everyone. But as I thought more about how I could serve the community, another idea came to mind, and it probably won't come as a surprise that one of the most common questions I'm asked is, how do I tie my shoes? And now you're thinking, how does he tie his shoes? So the idea was I'll make a funny video showing how I tie my shoes, and then I'll just put it online, and then it'll be there for all time. Anybody can watch it whenever they want. So to date, it's been viewed over 16,000 times, which is awesome. I love knowing that it's helpful and that people have been then using it. And I've made tons of videos since then, most of them showing how I do tasks that you'd never really think about. In fact, until people asked me how I do many of these things, I never thought about how I did them either. Things like flossing my teeth, putting toothpaste on a toothbrush, jumping rope, putting on deodorant, peeling an orange, which, side note, I feel like even if you had 6 hands, peeling an orange just will always be a disaster for everyone on Earth. But I did make a video of it, so yeah. So as I did these things, the community continued to grow And in fact, one of the videos I made was about how I zip up a coat with one hand. And Eric Thomas, he lives in Indianapolis. He has a little boy, Sam, and it was coming winter, so they wanted to know how to zip up a coat. So they went on Google, searched for how to zip up a coat one-handed, and there was my video. For the last several summers now, my family has visited the Thomas family in Indy, and Eric is one of my best friends because of that video. And that's the amazing thing about community and how it can happen. Then in 2014, the community grew even more. With the help of over 500 Kickstarter supporters, I was able to write and publish a children's book called Different is Awesome. So the idea from the book came from a real-life experience wherein my younger brother Joey brought me for show and tell. So he didn't like bring me to show and tell, he brought me for show and tell, which was fantastic. And so the book kind of retells that story. A little boy brings his older brother for show and tell, and each of his classmates gets to ask him questions about how he does things. And as you read through, you start to realize that each of the kids who are asking him questions are different in some way too. Whether it's that they're tall or short, or they have dark skin, or maybe they have a birthmark. By the end, the reader realized that we're all different in some way or another, and that is awesome. So the book officially released in July of last year, and the response continues to blow me away. I've sent copies to at least 20 different countries, including Peru, Australia, Saudi Arabia, Germany, France, Spain, just to name a handful, so to speak, I guess. Had to throw one in there, right? Give me a break. It's led to opportunities for me to speak at schools and events all over the place. Just this year in January, I was in Boston with a group called the Helping Hands Foundation. In April, I spoke at an event at the Children's Hospital in Los Angeles and got to meet my childhood hero, Jim Abbott. In August, I get to be a counselor at a camp in Northern California in partnership with the Shriners Hospital up there. And just before I came here, I was actually a couple hours south of here in Potosi, Missouri, at a camp called Camp No Limits, which is a place where families with children affected by limb differences in some way spend a fun few days together. So on a weekly basis, and honestly, it's closer to daily, I hear from parents and grandparents. I'm definitely going to cry, just FYI. I hear from grandparents and teachers and principals and just saying how much the book means to them, how helpful it's been in their communities, and that's incredibly gratifying, honestly. But when I see pictures of kids with the book, that's what makes my heart sing, and that's what makes me light up, like Grace was talking about yesterday. And then I get emails from parents who are like, "We read your book 3 times a night." And like parents, you know what that's like, right? Like, well, yeah, we'll read it again. Sure, this is fantastic. And then a mom actually in London sent me a video of her little boy reading it for the first time. And he's this tiny little guy, and he turns the page, and he sees the character with one hand like him, and his eyes just get huge, and he points at the arm on the page, and then he points at his arm, and he looks at his mom, and he can't even talk yet. But he's able to recognize that this is someone who looks like me. And that means the world to me. And so I share this with you to show that we can all build community. And when we build communities, we change the world. And we can start right where we are. In fact, I feel like we have to start right where we are. And the ways that we serve people on a daily basis, no matter how routine or mundane they may feel, they change the world. And you're changing the world, everybody in this room. And I know that sounds cliche, and it's something people just say, but the fact is it's true. And maybe something that gets in the way is that you have a different idea of what a world changer looks like. I know I struggle with that. When Doc was up here, I was like, that guy's a world changer, right? And I feel like, well, I'm not doing that. And I feel like we all feel like that sometimes. But right now, you guys are looking at me, but I want you to take a second and just look at each other. Just look around at the people who are around you right now. I'll see some of you are doing it. I want more of you to do it. That guy knows what I'm talking about. Awesome. Okay. So here's the deal. You were just looking at world changers. That's what a world changer looks like. Now here's the fun part. Those people were also looking at you. This is basic logic, people. This is not hard to figure out. So I know, even if you don't think it's true, I'm telling you that it is true. It's a fact. You are a world changer. Whether it's the patient that you're comforting, the daughter that you console after her mother passes, maybe it's that child that you make smile when you give them a high five, you give them a lollipop. They're part of the world, and you're changing that. You made their experience a positive one, even if only for that moment. And here's the deal. Sometimes that can be hard to remember, right? Days get long, and they get hard. But it's important to remember that it's the little things that matter the most. My journey started with a conversation with this little boy and his mom. And I encourage you to look for those moments, those conversations, those little opportunities that you have to build a supportive community right where you are, and then see where it leads. Continue to influence your communities in positive ways, and I would encourage you every night before you collapse, remind yourself, I'm a world changer, because you are. Thank you. So, I have one quick announcement before our next speaker, and that is I'm incredibly grateful and excited to tell everyone that you will all be getting a copy of Different is Awesome. So, the way that's going to work is, so the first print run was 3,000 books. I brought the last 100 of them with me today. So I have 100 books here today. So if you want one for yourself, for your family, for a friend, for your clinic, for wherever you want it, make sure you grab one. For everyone else, if we run out, or there are going to be these bookmarks that are out there as well, and they have a web address on the back. It's just livingonehanded.com/SSM. There are 2 questions there that you can go and fill out if you want your book sent to you when the second round is finished printing, which is going to be hopefully the end of this month, and then we can send you a copy. The other amazing thing is any copies that are not claimed are going to be donated to, I'm crying again, jeepers creepers, are going to be donated to kids at the camps and events that I go to. So I'm super grateful for that. So thank you guys.